Oh, hello. Are we on? Madam Producer says we're on.
Yay.
So, hello, America. this
Happy
is
Monday.
That's right. This is the Dr. Simonds Metabolics and Weight Loss Facebook Live Ask Me Anything event. It's Monday after the Super Bowl. We're here to answer your weight loss questions. Thank you for being in attendance, and thank you for sending in the questions. We're open today, as we have been throughout the pandemic, in both locations. And anyway, as I'm here with Michelle Kennedy. I think most of you know Michelle from who've been attending these. Michelle is the anchor here in our Raleigh office at the Falls of Noose location out near I-40, or correction, 540, out near 540. And she is well trained in obesity medicine, which you will not find amongst nurse practitioners. So one of America's most seasoned, if you will.
Oh, thank you. Yeah.
Yes, that's right. So, and she's good. So she's going to keep you on your toes. What do you say? You want to start with the questions?
Yeah. Thanks for everyone joining, and send us a message. We love to hear from people who are watching live that they're enjoying, or if they have a question, because we'll definitely address your question if you send it. But some of the questions you saw in the email, we'll start with Trevor from Raleigh. What are the benefits of a keto diet beyond weight loss? I like this question.
Yeah, this is good.
Yeah, there are a lot of benefits other than weight loss.
That's right, because it's all it's all about your metabolic health, and the weight is often tied to that, which is why we recommend the keto diet for folks. But I don't know that we spend enough time emphasizing all the other benefits you get with it, right?
I agree. Yeah, a ketogenic diet has actually been used for a very, very long time to treat seizures, epilepsy.
Right. Yeah.
It's also it was originally used to treat diabetes, I think before insulin, right?
That's correct.
So
yeah, we didn't discover insulin until 1924, and so prior to that, if you were to read various textbooks of internal medicine, the most famous one was by Sir William Osler, a British man and famous internist. He had the kind of the reigning champion back then of textbooks, internal medicine textbooks, and this was how they treated type 2 diabetes. Interestingly enough, along that line, they also didn't have urine dipstick tests for glucose. They didn't have these blood tests yet. So the way that you diagnosed it is you had the medical student taste the urine, and if it was sweet, why then you had diabetes, right? So I'm glad.
Yeah, we've come a long
by the time
way.
I came along as a medical student, we were more advanced than this.
Thank goodness. Goodness.
Yeah. Man, talking about hazing.
Right.
Yeah.
That takes it to another level.
Yeah, I'd say so.
Yeah. But it is the only way they knew whether they could
That's right.
bring blood sugar
Yes,
down
that's right.
was by doing that. And they realized that by removing starch and sugar from the diet, blood sugar came down. Urine wasn't as sweet.
That's correct. So they meticulously counted. So diabetes is a real good example of one of these things that gets better. When you take the carbohydrates out of the diet, you do a keto diet, diabetes, lipids, blood pressure, they all get better. Okay. So in the case of the diabetes, what they would do, and the person who did most of the work on this was a partner of Dr. Jocelyn Diabetic Institute. It's at Mass General Hospital, I believe, up in Boston. Very famous. Anyway, his partner was Dr. Frederick Allen. Okay. I'm a nerd. I know this sort of thing, So Frederick Allen did most of the admissions for Dr. Jocelyn. And so the diabetic would present to the office with the typical symptoms. They would then Allen would then hospitalize them. Okay. And what he would do was he would put you in the hospital on a fast. Okay. And he would allow only one thing on the fast other than water. And that was in the evening, he would allow you a shot of whiskey. Okay. So times have changed again. Okay. Yeah. So water and whiskey was the diet of Dr. Frederick Allen and Dr. Jocelyn prior to insulin. And, they would have the medical student taste the urine each day. And when the urine and the sweet taste disappeared, they knew then that the person's blood sugar had come down. They would then start out by adding meat to the diet and slowly add in things, butter, cheese, this sort of thing. And then they would start to add vegetables sparingly, but they meticulously counted the number of grams of carbohydrate that people were eating, right? And so thanks to two colleagues of mine over here at the great Duke University, Dr. Eric Westman and Dr. Will Yancey, they did a paper on this where they went to the archives up there at the Joslin Diabetes Institute and pulled the charts of these people who Dr. Allen had admitted, Frederick Allen. And they did a calculation on the average number of grams of carbohydrate per day that people were discharged on once they'd received this diagnosis. So when they added in the vegetables and so forth, when the glucose reappeared, they would take that number of grams of carbohydrate, and that was your limit. And you were discharged on a limit. The average limit was 38 grams of carbohydrate a day.
Makes sense.
Yeah. So that's when the glucose reappeared in the urine on average in these people. So they would have to stay under that. And this was how you control diabetes, type 2 diabetes.
Oh, so there is one benefit there.
Right.
Is even individuals who may not need to lose weight, it can really, really improve diabetes. It also drops blood pressure.
Yep.
It also improves lipids. It lowers inflammation. It really, I think for anyone who's been in ketosis for a long time, they will vouch for the fact that it really improves just how you feel overall. People report less joint pain, less fatigue, less foggy brain, because focus and mental clarity is also a really big benefit. And there is some evidence about anti-aging. So
yes, that's correct.
We know that insulin is a pro-growth type of hormone, and it can really accelerate the aging process and really promote inflammation. And a ketogenic diet brings insulin levels way down.
Yes, it does.
So the effects of that, other than weight loss, are all the things we just talked about. I think I would just well, first I'll say thanks to those who are online right now. This is our Ask Me Anything Facebook show from Dr. Simonds Metabolics and Weight Loss in Raleigh. Now, I just want to emphasize that inflammation point. Obesity is a very inflammatory disease. And this diet is, from the way that it works, is the most powerful tool you can use to decrease that inflammation, whether your weight returns to normal or not. And so there's really not a whole lot good that happens with this kind of pro-inflammatory state. And this is a natural way to treat it. We don't have anything better than this that's out there now. And this is one of the big reasons I put an emphasis on it. Because whether you're trying to lose weight or not, it's still about living healthy and living long, right? Have a lot of information on our website, and you can read through there. And we have a way for you to message us through the website if you need. Easiest way is probably to call us. So if you want to schedule in the Raleigh office, call the Raleigh office. If you want to schedule the Durham office, call the Durham office. And we will guide you on how to fill out some paperwork that we need you to fill out. and do some reading about some medications and some ideas about our practice and some dietary information. And then we can get you on hopefully that week or the next, whenever it works for your schedule. We have later hours in both of our offices as well. So if you really need an evening appointment, we can do that. And we try to be flexible. And that first appointment is 45 minutes to an hour typically. We don't require any contracts. So when you're making an appointment, you're just making that first initial visit with us. And during that visit, we come up with a treatment plan together. We go over some of your medical history. We do a metabolic assessment, including, are the medications you're currently taking, going to be a barrier or, assistive when it comes to your weight loss. Talk about dietary strategy. We talk about medications. We do have a pharmacy right on site in both of our offices. So it ends up being kind of a one and done. When you come in, you get a full plan. You often will leave with your medication. We also have some optional but wonderful products behind us here that you can see that we are big fans of, if that does fit into your treatment plan. And then we usually schedule you for a follow-up visit to come back in about 4 weeks. So we kind of streamline it, make it easy. We're really, I think what sets us apart is the difference with the upfront cost and the contract. We do not take hundreds, thousands of dollars initially. We do not make you buy any of the food that we carry in our office. It is, like I said, optional. And we really individualize the treatment plan. A lot of people come in and say, but what if I don't want to do keto?
Yeah.
We say, that's fine.
I can roll with it.
Yeah, we're flexible. We're easy when it comes to that. We want to find, through a partnership with you, what's going to work for you. This is not about us trying to push a certain thing onto you. It's got to work for your lifestyle, your wants, your schedule, everything.
That's right. Yeah. Okay.
So hopefully that helps. If you haven't called Serena, give us a call. We'd love to bring you in.
Yeah, it's not a long process. No. We just have you fill out some paperwork. No. We'll take care of screening all the right stuff, individualize a plan for you, get you going. In most cases, once you arrive to the office, it's 45 minutes or so,
right,
door to door.
Yeah.
So that's the idea. And then the follow-ups, really, they're once a month and they're not long.
And I think important too is once you have been a new patient once, it does not matter how much time has passed. If we've seen you regularly and then you take a little lapse and come back, or if it's been 10 years since you were to one of our offices, you're still an established patient. You will never have to be a new patient again. Yeah. So for more information,
SimonsMetabolics.com.
Check our website.
Yeah. Thanks for everyone again who's online with us now. We appreciate your attendance. Melissa Jordan from Durham. Yes. I've been sidelined. Oh, this is a question. So Jordan's been sidelined from a leg injury and from working out. He's gained a lot of weight. Will dieting help me is Jordan's question if I can't work out like I used to. Well, so the real question you're asking is, do I have to work out to lose weight? The real answer to that is no, you don't have to work out to lose weight. It's mostly about diet and less about exercise. And you'll find people who religiously work out usually have a pretty good diet. They're going to spend that much time doing it. It's the diet that carries you. Yeah. And so, yes, Jordan, you can lose weight. Just as much as you would if you were working out in most cases. But you got to get that under control. You got to bring that diet under control. And if you're having a problem with that, you need to call and make an appointment. We can help you. We can match you with medicine that's going to help bring your appetite, your desires, your cravings under control. And so that if we talk about, hey, here's the kind of diet you should do, talking about it, I always say, is easy. Doing it's the hard part. Okay, and this is where the medicine makes a big difference. Absolutely. Really helps. Absolutely. It works with your brain's physiology and your body's physiology to make sure that you don't overeat. Don't overeat the wrong kind of stuff. Stick to eating the right kind of stuff. Absolutely. Yeah. And I think this is a perfect question, especially at the beginning of the year, because I think a lot of people come out with their New Year's idea of I'm going to join a gym, I'm going to start a workout routine. Which is great because exercise has so many health benefits, but our patients are sometimes surprised to find us say that despite all of those benefits, weight loss is typically not one of them. Yeah. So if you're going to exercise, do it because it makes you feel good, because you can, right? You have to recover from your injury. But
don't do it thinking, well, if I work out more this week than I did last week, I should lose more weight this week. It's really what you've been eating that's going to make a difference. And that's what we do best here, is help you with the eating and appetite and cravings. So give us a call, Jordan. We can help. Now we can move on to Melissa.
Melissa, yeah. She's
Melissa
got
from
questions
Wake
about
Forest.
websites that offer phentermine for purchase online. What should I be aware of before taking it? Well, the first thing I'd say is phentermine is a controlled substance available only by prescription from physicians. So it is illegal to sell phentermine online unless you are a credible provider of virtual medical services as a physician. Right. And in most states, because this is a controlled substance, they're not okay with a first visit with a patient online. Okay. They state medical boards are pretty particular about establishing the physician-patient relationship in person, and then an online relationship after that for follow-ups can be conducted as long as there's very close monitoring in place of the amount of medication people are getting and so forth. So I'm not sure what kind of site you're looking at. I've seen sites that change just a couple letters.
Yep, I was just going to say.
A very common one is to take, it looks almost like phentermine. It sounds like phentermine. It's PHENTRAMINE. It's phentermine, and it's not the same stuff.
No.
It's not a prescription thing. It's a buyer beware scenario. It will not do the same thing. So there's a good chance you could be looking at something like that to spell just slightly different, and it's just a bunch of hocus pocus.
Yeah, and it can be dangerous. So you do have to be very, very careful, because sometimes you don't know what you're getting. You're
talking the fakes.
The fake stuff. The fake stuff.
Yeah.
I'm sorry, the online stuff that's claiming this is phentermine or it's just like phentermine. It's not, because that's not available to be sold online. So often what they'll do is they'll put a bunch of different stimulants, mostly caffeine. They'll put in there, and it'll give you some energy, but it is not doing the same thing. It works through a very different mechanism when we use prescription phentermine, as we do in our office and many reputable weight loss practices throughout the country. What you're getting in that scenario is nothing like what you can purchase over the counter or online. So
that's right.
Be very cautious with that. So you may think, well, I want to do it online because I don't want to have to face anyone. I don't want to weigh in front of anyone. I shouldn't even need the help. I'm just going to take this quietly and not tell anyone. But the truth is, there is no judgment. There is no shame in needing help. That is why we are here. I draw the comparison all the time with rheumatoid arthritis or rheumatologists. I say, well, if you had rheumatoid arthritis and your joints hurt all the time, why not go to a rheumatologist, and why not maybe get some medication? And then once you're on that medication and you feel better and you can move and your joints don't hurt, why come off the medication? Because then your joints are going to hurt again. Yeah. So I say that all the time for people who say, well, I shouldn't have to take a medicine, or I wish I didn't have to come here. I should just be able to do it myself. So I don't know anyone who's really curing their own chronic, metabolic conditions, without help. That's what we are here for.
Yeah. That's a very good point. All right, Jenny from Cary.
After having my third child, heaviest weight gain recently, I'm worried this time won't be able to get it off easy. How soon after pregnancy can I start a weight loss program with you? So I think we've addressed this on a previous show, but luckily it's a very simple answer, Jenny. As soon as you are done nursing, you can come back and get on medication. We will be able to help, even though I know you said this is your third and it's harder. It is likely going to be harder. Many women find that each subsequent pregnancy, and with age in general, it can get a little bit harder to lose weight. So we can have things that are more tailored to you, your lifestyle with 3 children versus maybe the first time when you just had 1 child. So from a medication standpoint, from a dietary standpoint, from a support standpoint, we can give you what you need at this point in your life, which may be a little bit different. But as soon as you're done nursing, give us a call. We are here to help. And at that point, you would be eligible to start really any medication. As long as you're not nursing or pregnant, we will make sure whatever is an option for you, we discuss at your visit if it is medication that you're most interested in.
Yeah, that's right. That's right. So we can help.
Yeah,
Yeah.
absolutely.
All right, Tammy from Durham, can you tell me more about the distance program?
Oh,
This
I
kind of ties into the
this.
question that we had from Melissa in a way.
Mhm.
Okay, so, we require people to come into the office for their first visit to establish the physician-patient relationship, right? But we recognize we got people that come from long distances, work crazy hours, and so, there's some need to have a little bit of plus with the pandemic and stuff, to have some flexibility in terms of, whether you come to the office or not for your follow-ups. We live in a digital era. So anyway, we have a distance program. We call it the distance program.
Yeah.
You don't have to live that far away to be able to do it, but we essentially set out a process where, you're keeping track of your weight and blood pressure and pulse and stuff, and sending us that along with a 24-hour diet recall. And we're conducting the interview with you over the phone. Mm-hmm. And then we have a shipping process right here from our pharmacy where we ship you the medicine via UPS. And basically the cost is the same as coming to the office, plus the $15 for the shipping on the UPS. That's what it comes down to. Mm-hmm. And if you're already an active patient, you've been to the office to establish the physician-patient relationship, then this is something you could do. Mm-hmm. And some people, by the way, will do all the shipping of the medicine. They'll either come by to pick it up later, or they'll come by and they'll be out in their car and call us and say, I'm here, and then we take it out to them. We're pretty flexible about stuff like that.
Yeah, and I would say the feedback we've gotten is patients, especially now, are so grateful for that option, because while there are and for patients who move, there are other practices doing wonderful things, when it comes to obesity treatment throughout the country. There's not that many of them, honestly. And sometimes, when you move, you're already dealing with so much else, having to reestablish with a brand new practice with, providers you don't know yet. It can be daunting, it can be hard. So in order to have that continuity of treatment, we have people who move. I've had patients who have moved several times, and they'll, once a year, they'll come back in and they'll visit and they'll say hi in person, and then we'll be able to resume their treatment through telephone visits, and it works out wonderfully. But then we also have patients who live very close by, right in the Triangle region of North Carolina, but their work schedule or caring for a relative or children just prevents them from being able to come in every month for their visit. And so they find it really useful to be able to do it over the phone as well, and then be able to pick it up or have a loved one pick it up, which is an option as well. And like Dr. Simonds mentioned, the cost is the same unless we ship it. And it's just $15 flat rate UPS. And that's been really easy for patients. We can have a signature required, but we don't have to. So a lot of people are worried, like, well, what if I'm not there to get it? And, that's okay. If we need to do a signature required, we can. But if not, it'll just be right in your mailbox, ready for you when you can come get it. And it's been utilized a lot, I will say, through the pandemic especially. So we've got it kind of down to a science. We have, a specific email address where you send stuff in. We do like to also get a blood pressure if we can, but you can get a digital blood pressure cuff on Amazon or at a drugstore for next to nothing. I mean, 10, 15, 20 bucks at most. They're cheap. Yeah. They're everywhere. They're cheap, so that we can continue monitoring. And the fact that you still have to weigh and take a picture, the accountability is still there.
That's right.
Luckily. So if for anyone who's watching or knows someone who say, well, I wanted to get back, but I just haven't been able to, let them know, or you yourself call. We'll do it as a distance. We'll let you know exactly how that's going to go, and we'll set it up as a distance call. It's very easy.
Okay, we got a few minutes here before we end this. Mm-hmm. And I want to take the opportunity to talk about something that not a lot of people are talking about. And I'm going to get up on my soapbox here a little bit. I'm not against news outlets, okay? But news outlets are not obligated to tell you everything. They're in the business of selling, advertising, and making money. Okay, I'm not pointing to anyone in particular. You just need to know that before you digest all of the information. You need to realize there could be more out there that you don't necessarily know about, and they're not obligated to tell you. There's no board of standards that's going to come along and make them. Okay, they're not even obligated to tell you the truth. They could call a donkey a whale and say it over and over again, and it's perfectly legal to do so. Okay, they won't do that, but anyway, I think you get the idea. So this is all in relation to the current pandemic. Okay, so I mean, I get the impression that people think, well, I'm scared about this, and vaccine, but I'm scared of the vaccine too, right? And I get all that. Okay. Look, I want you to know there's plenty of good information in the medical literature about supplements that you can use that make a big difference on whether or not you have any symptoms at all. If you develop symptoms, if you were to contract it, whether or not it gets severe enough to be hospitalized, or even worse, the risk of dying from this, right? Mm-hmm. And these supplements have a huge impact on that, and they're inexpensive. So one of the ones I want to really highlight is vitamin D3. Okay, and we sell it here at the office, but there's lots of good brands out there. I'm not here to necessarily drive you to the office to buy it. It's fine if you want to buy it from us. You ought to be taking at least 5,000 units a day of vitamin D right now. This has a big impact. Having a vitamin D levels on the reference range go from about, to my recollection, 30,000 on the low end, mm-hmm. and you check the lab test up to 200,000 on the top end, roughly. You got to be over 50,000. And because so many people are scared of the sunshine, when they don't go out in the sun enough to get enough vitamin D. And then because of the pandemic and stuff, we're all staying indoors, and this compounds the problem, right? So even without a check of your vitamin D level, 5,000 units a day at a minimum is what you ought to be doing. And that is a good preventative thing. The other thing that stops this virus gets inside the cell, okay? And it replicates itself in that first few days. And this is a good time to get on it, okay? And to break this thing, to stop that replication. The thing that does it is zinc. Zinc. Zinc comes in multiple forms. But look, the most common form is picolinate, zinc picolinate. And I tell people you ought to be taking at least 50 milligrams a day of that. Even 100's fine, right? That vitamin D and the zinc is absolute stone cold, a very good thing to be on during the middle of the pandemic. And then finally, there is a supplement called, some people call it quercetin. I call it quercetin. Queucertin.
And I say quercetin.
Yeah, quercetin. Okay,
so
you get tomato. You get it. Comes as a 250 and 500 milligram. It's very hot. People know what I'm saying right now, so they're buying it. So you might have to wait a few days to get it if you order it from Amazon, right? Mm-hmm. But you ought to be taking at least 250 milligrams a day. That transports the zinc across the cell membranes, all right, and gets it inside the cell. And so when people lose their smell and taste when they get COVID, it's because their zinc levels drop. The zinc is being used inside the cell to fight the replication of the virus. So I wanted to tell you about that because I can't tell you the number of questions I get about it. And people are shocked to find out that this works. Well, there are a number of literature-based, evidence-based protocols in place in very big medical systems around the country that utilize this. The one closest to us is the Eastern Virginia Medical System. Think UNC, all right, that same size, but up in Eastern Virginia around Norfolk and Portsmouth and all that area over there. And their head of pulmonary and critical care has published and continually updated their protocol for prophylaxis for their staff. And they use it system-wide, and it includes what I just said. The evidence is in the medical literature. And this is stuff that, it's really, I think it's really important and can set your mind at ease about some of this stuff. It's something you can do to make a difference now. That and being on a diet that's non-inflammatory, right?
Yes.
Okay.
Absolutely.
So getting that flour and sugar out of your diet, taking these sort of supplements, I highly recommend it. I think it makes a big difference. And because I get so many questions about it, I just wanted to put a plug in for it. We don't even sell the quercetin, the quercetin, or whatever you want.
No.
We don't even sell it here, so it's not about money for me. Okay. I don't even think we sell the zinc, so it's not about money for me, but I wanted you to know that stuff. Okay.
And there's going to be more information on our website about this.
That's right.
And if you did choose to buy the vitamin D3 here or anywhere, keep in mind D3 and zinc, super, super affordable. So you should not have to pay a lot for that. The quercetin will be a bit more, but worth it.
Yep.
Worth it.
Yep. All right. Well, I think we're coming. Are we at the end, Mr. Producer? Okay.
Yeah,
there we go. All right. Well,
watching.
thank you very much for attending the Dr. Simonds Metabolics and Weight Loss. Ask me anything, Facebook Live, and we'll talk to you again in 2 weeks.
Share this.